Drizzy and T-Money blasting off the map. Mic check one, we igniting the chat. Big thoughts, big laughs, real talk on tap. From the stars to your ears, it's a certified slap. We break limits, no rules, no fear. Dropping gems every week, loud and clear. Vibes interstellar, mind so clever. Tune in once, you'll be hooked forever. This the blast off, where the wisdom collide. Rocket fuel flow, let the convo ride. From the cosmos down to the city stride. Every episode another joyride. Catch the wave, let the banter take flight. Brainstorm sparking through the depths of night. Underdogs talking, put the world in sight. All killer, no filler, just truth in the mic. Zone out, let the speakers combust. In a convo with hosts you can trust. Groundbreaking spins, no fine gold dust. It's a must, turn us up, adjust. This the blast off, where the wisdom collide. Rocket fuel flow, let the convo ride. From the cosmos down to the city stride. Every episode another joyride.
Don't sneeze on me.
Sorry, T-Money.
Get the hell out of here, Drizzy.
Okay. Welcome back to the Don't Sneeze on Me podcast. What up, T-Money?
What's going on, Drizzy?
Well, we're hanging out. We're enjoying this beautiful, beautiful Sunday.
Absolutely.
The sun's shining. There's so much natural light coming through, and I just can't wait to get outside for a little bit.
Needs to be a little warmer.
A little warmer would be nice. It is like low 60s right now, like low 70s would be ideal.
Ideal, because next week it's gonna go up to like 80, so it's like we passed the good number and went right to hot.
I know next week it's going to be like 80 to 90 all week. I'm actually really looking forward to it.
I like it, but at the same time it's too fast. It's like
It is too fast.
Some gradual.
I want to stay in the 70s. Like I love like low to mid 70s, even high 70s. I'm good with that, but like stay there for a little bit.
Because you're not sweating.
I'm not sweating.
Mm-hmm.
You can just wear a t-shirt. You can wear long sleeve and shorts. You can wear something like that and still be comfortable.
Mm-hmm.
But like 80s, that's when it's like summer weather. Yeah.
We just go past right past.
But I
spring.
still enjoy it. I love summer. So, I enjoy it. I love like dressing for summer and going out and all that kind of stuff and just enjoying the weather.
I have to agree with you because it just really is. It's just you're able to be outside. You're not stuck indoors anymore.
Mm-hmm.
You can have the windows open. I love having my sliding glass door open with a little breeze coming in, and it's like it just makes the house feel just that right. It's like that 70-ish, 69 temperature.
That's
it's
like
like,
now I have all the
crisp.
windows open.
Mm-hmm.
It feels so nice. Little breeze coming in.
Yeah.
But I will say, the one thing that always happens to me with the change in the seasons. My allergies. Tino's. I had to get up and immediately take my Flonase this morning just to get going for the day because I was all sniffly all night and like my allergies get so bad. And I remember as a kid, when I first started getting seasonal allergies in Chicago, like 15, 16, I would get the worst sinus infections every year.
Oh, yeah. I mean,
and it was horrible.
You can see it because you go out to your car and your car's covered in greenish, yellow, like pollen, obviously. And it's just gross, but it's when you see it on your car, you realize that's all in the air.
I'm breathing
and
that
you're breathing
in.
that in.
Yep.
And
I'm allergic to it.
Yeah. Every single time.
Yep.
I mean, it's beautiful because all the trees are flowering. And,
oh my gosh, especially here.
Yeah, everything's starting to bloom, and so it's like it's nice. The grass is turning green again.
Oh, I love it. It's gorgeous.
But you pay the price because you're like, achoo!
I can't breathe. I'm breaking out in hives.
Yeah, you don't want to be.
I'm miserable. I can't see.
I always tell you, don't sneeze on me.
Don't sneeze on me.
So,
don't get me sick. I can't.
exactly.
I can't afford to go to the doctor anymore. I don't know. It's crazy. But yeah, I have to start my Flonase early just to avoid it because otherwise I end up so sick. And the one thing I cannot do, I can't go to the doctor because anything that is not like a standard appointment that's covered, like a regular checkup or like, an annual physical or something like that, I cannot afford the darn appointments anymore. The cost of everything is just out of control.
I mean, the whole healthcare system really, it's exploded into more than, it's a business that wasn't intended to be a business. I mean, I understand that, yes, you have to make money and stuff like that, but now the cost of seeing your doctor It's like there's a copay, there's like additional costs. What if they're not in network? Good Lord.
And then being billed later for any out of pocket
Oh
costs,
yeah.
things like that. Like I feel like you never know how much you're actually going to pay, and it's the worst. And I don't know about you, but biggest my biggest thing that bothers me, what really grinds my gears,
You know what really bad?
with the insurance companies, like how
Oh my
they
God.
process claims and things like that. Like insurance companies are playing doctor, but these are people with zero medical background or knowledge, and they're deciding to approve or deny your care, how you should be treated. And
And
they
that
have no idea
it's just ridiculous. It's like, you
based
know,
on billing codes
yeah,
or whatever.
or when your doctor says you need something, listen to him. That's what he went to school for. He saw you in person and goes, you know what? This person needs this procedure, or they need to be on this medication. And yes, I understand there are some times where prescriptions are written where maybe you didn't need it, or
Hmm.
maybe you could have toughed that one out.
Yeah.
I do agree that we do overprescribe
Yes,
sometimes.
absolutely. I agree with
But
that,
at the same
especially
time,
antibiotics.
there are times where you need to listen to what the doctor is saying. Some
Hmm.
guy that is, sitting behind a computer desk and looking at it and goes, oh, that's not covered. It's like, check that off. And it's like, or, your doctor has to, fudge the number so that it does get covered
Hmm.
because the insurance, it's like they know what doesn't get covered by the insurance. It's like,
Yeah.
if I pay for insurance, that should ensure me that whatever I need
To
is
receive
covered.
the care that the doctor says
Yeah.
that you need, the best care that can be provided to you to help you navigate whatever you need to.
And it's just crazy that insurance companies can deny it.
Yeah, procedures they don't even understand. They're
Yeah.
denying
I
them.
mean, you didn't see me. They did. They looked me over. They
Hmm.
listened to my body and said, "You know something?" or looked at the blood test results and goes, "Ooh, that's not good. This
Yeah.
person needs to be on this medication," or, "Oh, the red or white blood cell count is really high." It's like,
Hmm.
we got to figure out what's going on. Listen to the doctor. Don't make a decision because, oh, well, their insurance plan doesn't cover it. It's well,
One thing that was really just a big eye opener for me is when my daughter was a toddler, she was sick and she got a kidney disease, and with that, after relapsing a few times, she had to go on a more aggressive chemo medication. And this medication at the time was like the closest thing to a cure they found for
mhm.
the disease that she was fighting. And insurance denied the medication 3 times. We had to appeal it 3 times before getting it approved. And the first batch of it was a 10-week course of treatment. The first batch, like the first 5 weeks, I had to pay out of pocket.
Oh my god,
And
it
I
must have
did
been
not,
really expensive.
it wasn't. Luckily, we found a
Oh,
great
okay.
family owned compound pharmacy that like really took care of us, helped me pay like half and half. And like it really wasn't crazy expensive, luckily. Um, but the fact that it's something that like my daughter needed after multiple relapses, after trying all these different things, after being on steroids for a year straight, essentially, like it was the next step. And it took 3 appeals.
Now, did they tell you why they were denying it?
No, they don't really give you anything. They're like,
So,
this isn't like a needed course of action or whatever.
oh
And
my
then they were
god.
saying one time they denied it. They said, well, she needs a biopsy before we approve this. I'm like, so you want my daughter to have a surgical procedure? She's like, a year and a half, 2 years old at this point. You want her to have a
Mhm.
surgical procedure to be able to take this medication that's going to put her into remission? Like,
Yeah,
that's
it's just
crazy.
crazy.
And I
It's
will
crazy
say,
that they're able to do
yeah,
that.
the medication, it put her into remission for 9 years. Nine
That's
years,
that's amazing.
which is amazing. We have now found out about like later, like side effects from it and stuff
Yeah.
that we'll have to monitor going forward. But she did relapse. She relapsed last year. She was able to take like 1 dose of steroid or like 1 cycle of steroids and get through it. And she's
Hmm.
been fine since. So we're going to have to closely monitor. But the fact that it helped for 9 years, but took 3 appeals
And it
three
just
appeals through our nephrologist, through our pediatrician appealed it as well. Like everyone appealed it for us,
mhm.
and it's just crazy because these people they're just sitting behind a computer.
Yeah, they don't know.
Yeah.
They're just following the procedure that is told in the office. I mean, that's the crazy thing. It's like they look at a printout from their management, and it's like, oh, yeah, not covered, or oh, this might be covered if it's under this, but
Yeah.
because it's not under that, it's definitely not covered.
If a doctor writes it a certain way that doesn't code the right way, yeah, it doesn't align. So I've had some great nurses that I've worked with that have coded things in other ways, but it's you have to work with the right office.
Exactly. I mean, it's just crazy because the patient is really stuck in the middle between the doctor and the insurance company, and that puts us into an unfair advantage. It's like, because we don't know. We're listening to what we consider a medical professional who's trying to maybe help us in some way, or make whatever we have maybe not as bad, and maybe, like you said, go into a remission. Yes, it can come back, but we'll hit it again. Yeah. And we'll get you through that one.
But we'll get through 9 years of nothing. So that's great.
Yeah.
But I just think about, like, with the delayed care that can come from, like, waiting for prior authorizations, getting denials, having to, go in and appeal those. I've seen my mom have to appeal procedures that doctors have recommended that surgery has denied multiple times. They've said, nope, you need to go back in. Even though you've been dealing with this for years, you get injections, you've tried everything possible before you can even think about surgery. Try physical therapy again for another 8 weeks. And then if you do that, we'll then approve you for surgery. So she literally had to do that. And then they're like, okay, approve for surgery. So she had to waste all that time, all the money, and, like, essentially get worse throughout the time. And the surgery have to be more extensive because what they put her through.
Yeah.
I just think, like, delayed care, it's like worse outcomes, which is such a money grab, which aligns with how insurance companies they just want all your money.
Jump through all these hoops, and then, oh yeah, we're still going to have to do probably the first thing that we probably could have done 8 weeks ago.
Yeah. I mean, like, medical billing is definitely a scam.
Oh yeah.
Absolutely. Like, the bills I've gotten from hospitals and things have been so outrageous and so varying, and just they don't align. It's crazy.
I mean, like sometimes simple procedures can be like, which should only cost me $20 or $30. They're like $300-400, and you're like, for what? You're like, what? It was a shot.
God forbid they give you an ibuprofen while you're in the hospital. They're going to charge you about $250 for it.
For one pill.
It's crazy.
It's like, and don't forget the delivery fee that then there's bringing it into you.
The administration fee, like all of this. Yeah, like they just add on these a la carte prices for everything.
And it's for simple stuff too. Like you said, like an ibuprofen. It's like, that should be, that was 10 cents, and the delivery cost was 55 cents because they had to walk 55 steps.
Yeah, I had 2 years ago, I received a bill from a doctor's office that was $200 more than it should have been. So I looked at the itemized bill, and I was like, why is this so high? And it said I received an ultrasound in office. I did not receive an ultrasound in office. But tell me why it took 8 months to get that charge removed off the bill.
That's just crazy.
8 months.
So who wrote down that there was an ultrasound?
It was just automatically billed that way because of the type of procedure that I got. Like, because typically you may get an ultrasound, but she didn't need to do it. Like, it was unnecessary. So, but it was just kind of auto billed. But I'm like, you need to go in there and make sure you're billing things and putting the right codes in for procedures, because she even said, I'm not going to do the ultrasound. We don't need it. So don't bill me for that.
Well, I mean, have you ever had to ride in an ambulance?
Oh my gosh. Yeah. So I was in a car accident when I lived in Virginia, and it was a pretty bad one. My car was totaled. This guy blew through the light and just turned in front of me. It was not good. And ambulance had to come and take me to the hospital.
That was the most expensive ride of your life.
Well, I mean, I don't know if you know about this with car insurance and what's covered, and like how health insurance works with car accidents and all of that. If you're in a car accident, your health insurance is not paying anything.
Why? It's
because they wait for the settlement from the car insurance to cover it.
Wait, what?
If you are in a car accident, your health insurance does not cover it. It becomes an auto insurance claim.
But you're having medical procedures done.
Yes, correct.
So it's a medically needed thing.
Correct.
So it should be medically covered if it's a medical procedures are happening inside. Oh my goodness.
So when I got in that car accident, nothing was covered by insurance, and I had to wait for the settlement from the accident to come.
That must have been like $1,000.
What?
Like the ambulance ride.
Oh, the ambulance. It was about like 600 or 700, and they had
How many years ago
they
was
had
that?
to. This was, oh my gosh, this was in 2012.
So
I think.
by now,
Yeah, 2012.
By now the inflated prices must be like almost $2,000.
Oh my gosh, yeah, like that was, think about, oh my God, how many years ago was that? 14 years ago? Wow. Yeah, I mean the prices are definitely up from 14
back
years
then
ago.
that was a lot of money.
And that was Virginia, so it was less than, what it would be here in New Jersey.
Oh, absolutely.
Yeah, and they had to stop, administer medication and all this sort of stuff in the ambulance. Like it was a whole thing.
Oof.
So
yeah, as I said, that was the most expensive cab ride you ever
oh
had.
my gosh, 100%. So if I don't need to call an ambulance, I'm not going to call an ambulance. If I can drive there, I'm going to drive there. Like I'm not going to rack up the medical bill that comes with calling the ambulance, because they can pretty much charge you whatever the heck they want to at the end of the day.
And there's no way to fight it.
No way.
Because you had to be taken in an ambulance.
And to some extent, I do understand that they have to like inflate their prices, because when they do bill insurance companies,
well, they get denials.
Yeah, they get denied, or they get like they have to negotiate down. So they have to start high to be able to negotiate down to something.
The middle price that
exactly.
both of you are okay with. Because I mean, I've seen that on my medical bills before, which is like, the dentist, because I see it on the dentist bills mostly. Yeah. It's like the dentist charge, $200. The insurance said they would pay $120. Mm-hmm. You owe, the dentist agreed to $150. You owe $30. Yeah. It's like something like that, and it's like oh, okay. It's like, well, I mean, at least I'm not gonna pay the $150. I mean, but still, it's like that. Why should there be like a negotiation? It's like
there shouldn't be.
It should be. This is the cost. The doctor should be lower, and then the insurance company should pay that. Normal average pricing.
No, that we like the price transparency. It should be upfront. Like there should be like a menu essentially of, this is what your insurance covers. This is the cost to you of the services. Yeah. Like break it down for us. Like it should not be that hard.
If I saw it, I think I would feel more comfortable with it.
Absolutely. If I saw a menu of pricing and knew exactly what I was paying for and what I was getting.
Transparency is all we ever ask for.
Absolutely. It's the surprise billing and the unexpected costs that really get you in the end.
After the treatment has already happened.
After
so it's like
happened. Yeah, you can't even go back and say
like,
no.
Oh, I didn't need that. Like, or I didn't want that.
Oh, and God forbid it was like a major surgery or something that you're staying overnight in the hospital.
Oof.
Every little thing that they do, just sneak in your own meds.
Here's a plastic fork. That'll be $350.
Yeah, have your family bring you food, sneak in your own meds, like whatever. I know that's terrible advice, but it's like you got a penny pinch where you can, because they will charge you out the wazoo for every single thing, and like all the negotiated rates are all hidden. It's all unexpected costs and fees and everything, and it's like sometimes even with your deductibles and insurance, you still don't know what you're going to be responsible for, especially if it's lab tests and things like that.
Because it just, your doctor is prescribing or saying that you need to have this done. Mm-hmm. And I said, it's like, if you're in an emergency, like you can't even say yes or no. It's like,
I mean, you can, but you can't.
Yeah, gurgling up blood.
Yeah.
What did he say? I think he said something about his teeth.
You're stuck with whatever they want to charge, because it's like, well, they had to save my life, and this is what it is. Like, you hope that maybe you can get approved for charity care for whatever you're left to pay.
That's what I thought was really interesting, is that if you don't have insurance versus if you do have insurance, it's like, so if you don't have insurance, they charge you less.
Yep.
And are okay with that. But if you have insurance, they charge you way more.
Yes.
And then your insurance company pays it. It's like, well, how about you just charge everybody the less price, whether you have insurance or you don't have insurance, and then insurance will pay that exact less price, and then guess what? We're done.
No, that makes me rage on the inside, because recently I did go to an office where they're like, you have insurance, so that's going to cost this much. And I was like, okay, what would it cost like out of pocket?
Yeah.
And it was less than what my copay was for insurance. Like,
That's
it wasn't
crazy.
significant. Like, my copay was like $80 for the appointment. I think it was like $70 to pay out of pocket for the appointment. They're like, well, no, you have insurance. It's on file. So
they won't let
we
you
have
choose.
to bill
Exactly.
through
They
that.
won't let you choose.
And I'm just like, that's crazy. You know what else got me recently too? Ooh, this is something that I was just reminded about is like prescription costs and how much those can even vary and how not regulated they are.
Well, I mean, it's just crazy because, you know, when you're charging like $500 for a prescription that's 30 days.
Yeah.
Not even like 500 for
outrageous.
for 30 days. It's like,
and it could be something that somebody needs to live on.
Absolutely. It's like, you know, like insulin. Like when that guy who, you know, was providing insulin to the US, and he like quadrupled or like 6 times the amount of the, of the price, and gouged it up, and then people like really went after him until he brought it back down. Like, that's crazy. It's like, you know,
these are life-saving medications that people need to survive.
It's just absolutely okay. I mean,
well, I thought it was so funny because recently I had gotten a medication, and the first time I had gotten the medication, I got it from one place, and they charged me, it was $60 for a 30-day prescription. That's with insurance. And I was like, that seems pretty like outrageous for this type of medication, this low dosage, like whatever. I ended up the next time I got it, I went somewhere else to a different store, higher dosage, 60-day prescription, and it was $12.
Well, you know, that's crazy because, you know, why is the price fluctuation so different
I don't know.
From where it's not even that much of a distance, probably.
Yeah,
it's
CVS,
probably,
like that CVS was where it was like $60, and then I went to ShopRite and it was $12. So now I'm like, I'll get all my prescriptions at ShopRite, like, and now I don't trust CVS with their prescription pricing and their price gouging.
Well, you know what's crazy is, you know, have you ever heard of that Good RX app?
I love Good RX.
I use that, and it's like sometimes when I go to, I open it up, it shows me the difference in price.
Yep.
And it's like you can choose where you want your medication to go to, and it's like sometimes it's less using that app than my insurance. It's like, why is there such a huge variation? Just everybody pays the same.
It should. Like, it should be consistent. Like, there should be set market prices for prescriptions across the board. Otherwise, this is what happens. Companies can individually like increase the prices, hurt their customers, but people feel obligated to pay it because what else are they going to do?
Yeah. I mean, but you know, the worst part is, you know, this in-network, out-of-network, this situation. It's like, you know, why is there such a difference? Why can't we just have insurance? Like, you go to one doctor, it's covered. You go to another doctor, it's covered.
Yeah.
You know, that just drives me mad.
It's so funny that you said that too, because I have had instances where I was in the hospital and I got billed later because while the hospital was in network, the physicians or the doctors that I saw were out of network, so they had to bill separately. I'm like, that's not okay, but that's happened to me. And then they'll like send my lab work to a lab service that's out of network. So then I'll get additional billing for that, and it's just like,
do you think they do that on purpose?
Fair. I don't know. I'm sure they just have partnerships with certain labs and certain networks and things like that. So I understand that, but it's like, I should have the autonomy to be able to choose all of that. And sometimes you do. There are some networks and like some physicians that will work with you and give you all those options. But in an emergency situation, you can't make those choices. You know what I mean? Like, you just have to do what you need to do. And it's just really unfortunate. I remember like when my daughter first got sick, as I mentioned, at the doctor, we dealt with that. They like sent her testing one thing. The doctor was in network, luckily, but then they tried to set us up somewhere else and it was out of network. And it's just like, no, we need to stick with what's in network.
Have you ever been double billed?
I have looked at my bills very closely, and there have been double charges for things multiple times on bills.
I got it when I was like getting a flu shot. I had 2 flu shots on there. I was like, wait. I was like, why?
Scamming insurance companies.
And they went through it, and like they were like, oh, you know, they didn't write it in twice. It got put into the system twice because 2 different people worked on this account. I was
no,
so
you can't double bill for that.
I was like, so it was your fault. You didn't look at
They're
it.
putting in false invoices to insurance companies.
No, like I said, it wasn't even the doctor. It was the insurance company put it in twice because they weren't paying attention on the account.
Oh,
so then they sent it
interesting.
out. So the insurance company. So it's like they were trying to get the charge twice. It's like, so I ended up owing more. So they would have ended up owing me back.
That's crazy.
It's just I don't understand that.
I just feel like there's a lot of carelessness in billing, and like I said, a lot of things are just kind of like they click in the computer and that's it without actually looking at it or auditing
you don't pay attention to it.
Yeah, but I do.
Yeah,
I do.
Well, as an adult now, I do.
Oh
when
my
I was
gosh.
younger, probably not. But now I'm like very, very cautious and aware of it.
Most fascinating bills ever, because I've had 2 kids. The billing statements from delivery.
Oh, good Lord!
From being in the hospital,
no way. I don't even know.
From all of it. From
here's your child, $50,000 later.
Yeah, no, it was crazy high, and like all the itemized things in there, and you're just like, what? And it's like you're so like paying attention to your baby, and not even the moment that like I bet if I did go over that bill and actually itemized everything, most of that stuff didn't even happen.
Yeah, exactly.
Yeah.
It's like and there's so many charges on there that they're hoping that like it's just like you're just skimming through it. And it's like
they don't expect you to sit there and go through and then sit on the phone with the billing team like questioning every charge, but you better believe I did that.
Oh yeah, they hope that you don't catch the errors.
Yeah. Well, the doctor's office had overbilled me for my copay for delivery with our insurance over the time. So after I delivered our daughter, we ended up getting a refund check for like $300 because the doctor's office overbilled us, so because we made payment plans up to the time that she delivered.
Funny. It's like when you get that back, you're like, yeah, stick it to the man.
Yep. And then for my son, luckily, like we had Medicaid at the time, so I had New Jersey Family Care for us. And so his birth was completely covered, but seeing the bill was crazy just because they're billing the insurance company that you're covered with for it, and it's an outrageous amount.
Well, also because sometimes these bill statements are really confusing.
Yeah, they are. And
it's like
everything's coded.
Yeah, they're not straightforward. It's like, or they're like hyphenated. So it's like you don't really know what it's supposed to say.
Yeah.
And you're like, okay, yeah, I guess I got that.
You know what's good for navigating that now? ChatGPT.
Oh, ChatGPT.
Throw all those medical codes in there and be like, break down this bill.
So when AI takes
itemize
over.
It all. Yeah, so it knows exactly what happened to me. Has my entire medical history.
It goes, go for your kidneys.
At this point, fine, go for them. They're good. No, actually, not my kidneys. Those are the ones I want to save. Anything else? It's up for grabs. But it's crazy because the bills are so confusing. Like patients will rarely question them, and like errors are so common, but it's like the patient has to be the one to catch them because insurance and the hospital, they're not going to go through and comb through the bills and look for those errors
because you are a number. And like, this is a business.
Yep. But God forbid you don't pay, they're going to be blowing up your phone.
Yeah. They will make sure you're hurting.
I don't know, but like, why do you think the system is like this in the U.S.?
Because it's profit driven.
I mean,
that's. I mean,
it's corporatized, unfortunately.
Unfortunately, with the insurance, because they're in on it too, is and the food corporations is what's in our food is making us sick.
Oh,
sick,
absolutely. I believe we're being poisoned constantly by what's in our food.
And if you keep us sick, you keep the healthcare industry going,
making money,
and it becomes a business of keeping you sick. And if you're sick, they make money, and the sicker you are, the more money they make from you. And they'll be like, oh yeah, that was a $2,000 charge for, what was it, 2 needles? Yeah, 2 needles, 1,000 needles. There you go.
I love that you said that. I love that you said that because I feel like the U.S. we're so loose with our food regulations and what we allowed to be in our foods and everything like that. And when you think about that, like the FDA regulations and then like the insurance regulations and the healthcare systems, those are all so closely linked that FDA gets away with approving things and allowing things in our food because it makes us sick and because it helps the insurance companies make more money and makes the foods addictive. So everybody keeps making money.
You know what?
It's a whole thing.
Why? I understand that sugar is the enemy, but why can't we just have real sugar and stuff? Why does
real
it have
cane
to be,
sugar.
Why does it have to be like 25 different, chemically altered sugars that are put into food for sweetener? It's like, okay, I understand sugar is going to affect people with diabetes
Hmm.
and stuff like that. I get it. But you know something? I read recently that China is getting close to having a diabetes cure. So we're getting closer to
Yeah.
making a healthier population, but take the poisonous sugars and chemicals out of our
I
food
agree.
and
It's so
allow
much
us
of
to
like
live.
the colors, dyes, preservatives, and
Oh
all of
God.
that are just so
The,
awful.
the the
And it's
orange
like,
soda that's neon color here and actually
yeah.
carrot color
And
over
I
in
mean, I'm
Europe.
not gonna lie, like I partake in eating the
Yeah,
not so good stuff. Like I
so do I.
definitely balance, like I try to keep a good healthy
I like a
balance
good
of what I
Skittle.
eat, but like love Skittles, love me some orange soda.
Yeah.
And it's, so it's like I just wish that there were, I mean, there are healthier options. I'm not going to say I wish that there weren't, but I wish maybe there was more natural candy options that didn't have all those things in there that were
Mm.
easily accessible. Like I would love to get a pack of Skittles without the extra dyes and the like
Yeah.
as potent flavors or something like that. You know what I mean? I don't know.
I mean, I agree with you. It just we really have to, correct the whole system, not
Yeah.
just the healthcare system. We have to correct the whole system. But
Yeah, but we have like
you
the least
know,
least power in the system as
yeah, because
patients.
we are the middleman,
Mhm.
and we people are deciding our fate
Yep.
for us instead. So what power do we have?
None. None. And as you see, like insurance costs go up and up and up every year. Your premiums go up and up and up.
Oh my
The
God.
the the out of pocket costs keep increasing. Your deductibles just
I
keep
don't. I just
increasing.
don't understand deductibles. It's like if I have insurance, why should I have to pay
Why am
extra
I paying
money?
more?
I don't get that.
I
And it's
don't
usually
either.
it's a fraction of what the whole cost
Mm-hmm.
is. So it's like it could be like a $200 deductible, and you're like, what the hell? I mean,
Yep.
like not that's rare,
Yeah.
obviously, but I mean sometimes it's 20,
Depending on the
$30.
service, it could
But
be.
it's just like when I go for a physical or something like that's the only time that it's ever fully
Mm-hmm.
covered because you're doing a preventative checkup.
Yeah. God
But
forbid you go for anything like an
you have a
illness or
cold,
anything. Oh
God, if you have a
gosh.
code, it's like that would be $40. You're like,
Yep. If you
wait,
got to go to
I
urgent care, it's $100 out of pocket
oh
for
my
me. It's
God.
crazy.
And it really the patient really has the least amount of power, and they shouldn't. And I think it should be doctor, patient, insurance.
Yeah. So, I mean, a year ago, and I don't know who else knows, but like, a year ago, I had shingles and
Yeah.
I got it.
Oh God, I felt terrible
It
for you.
was really awful.
Yeah, you
And
looked always in pain.
I was in,
I felt horrible for you.
I was in a tremendous amount of pain. I still have nerve pain from it, but while I was dealing with it, I had to go to so many different doctors. And I
Mm.
was in urgent care and I was in the emergency room. And like the bills that I got after all of that, just for like pain management and trying to navigate this extremely like miserable condition, like it was so expensive
Uh-huh.
afterwards. The major bills, the costs, all of this. And I, it was it was to the point where it's like I couldn't even
It was
afford to keep it
overwhelming.
was so
Yeah.
overwhelming. And I'm like, because I got shingles,
Yeah.
this is what I have to go through. Like it just
You
seemed so outrageous.
you gotta pay an arm and a leg because you got sick for
Mhm.
something that you had zero control over.
Yep.
It if you people I'm gonna tell you the medical truth right here. If you've ever had chicken pox, you have the shingles virus in you.
Yes, you do.
And
Anybody who has had chicken pox can get shingles
and
at any time.
and let me tell you
You don't
this.
have to be old.
The older you get, the more likely you are
Yes.
that it could happen to you. So all of us that are getting close to that 40 age or maybe are in their 40s,
Nah.
um that we have a higher chance of
Yeah. So I just want
getting
to
it.
really
So
quick,
mhm.
if you're old enough to get your shingles vaccine and your doctor allows it, do it. Do it.
It is getting
Do
younger.
it.
Because I
It
asked
is
about
getting
it.
younger,
You
and
have
I
to I
will
think you have to be
say,
50.
like I'm 38, and so many people I know.
You look so good for your
Thank
age.
you. So many people I know around my age have also had shingles.
Mhm.
So I was shocked to find out how many people my age have been infected by it. But beyond that, it's just something like that it's like it can just happen and we have no control over it and can
Mhm.
happen spontaneously at
One
any
morning you wake up.
time. I just woke up and I was in pain. And that ended up costing me so much money out of pocket.
Yeah.
And it was
'Cause you had to go to
so hard.
specialists.
And I didn't want to go to the doctors because it was so expensive and the medication was expensive and everything. And like that made it almost just as unbearable as the pain itself.
Yeah.
Yeah.
I mean, it becomes overwhelming.
Yeah.
It's just, it's too much. And then, it's like, it's like you don't have anything else in your life. It's like, that is your life. Like
Yeah.
you're calling them on lunches. You're calling
Oh
them
my
on
gosh,
breaks.
shingles was my life, solid for a month, and it's still, unfortunately, the leftovers is like part of it. But it really took over everything, like dealing with doctors and all of that, and it was very all encompassing. But beyond that, it's just medical care shouldn't be like that. And we shouldn't have to pay for every single thing. We should not be concerned about like going to the doctor and how much it's going to cost when we actually need care. So it's like I do think about so many other countries and how their healthcare is set up. And universal healthcare to us, when we pay so much for private healthcare, it sounds like a great idea, right? Like in theory,
it does. In
free
theory.
healthcare covered by the government.
Mhm.
Wow. But like, do you think it actually works?
So listen, I've heard that universal healthcare. So with my job, I work with an international boss. So he lives in Ireland, and he has universal healthcare.
Yes.
And he said, yes, it is good. It does have its downs, but it does have a lot of ups. But that it covers everybody, and you can go to any doctor anywhere in that country, and it is covered. And the one thing that he did say is that yes, there can be some longer lines, and there can be a waiting period, but that's understandable. But you still can get in there.
Yeah.
It's part of it. But the one thing that I found out, which I thought was interesting, was they can also subscribe to a private healthcare insurance that allows them to sometimes skip those lines because you have an additional insurance on that. But he said it's not that expensive. He goes, it's a secondary.
Depending on the plans you get, depending on the country that you're in, because some countries the private healthcare is very expensive, but the care is top notch.
Yeah.
It's better than any care you can get here. Like the universal healthcare, like yes, if you go to the hospital, the lines are going to be long. You're going to be waiting for a really long time. Urgent cares, things like that, it's going to be a long time. If you need a test or a special scan, you might be waiting a while to get it.
So that's
God
the
forbid
down.
you need to see a specialist. It could be months and months before you can get an appointment. But with the private healthcare in those countries, like you said, you completely skip the line and basically can get in faster, get in better quality care. But you're not paying even close to the same amounts that you're paying here in the U.S. for that.
Listen, and
now, if we're wrong, correct us. Let us know. We would love to hear your feedback on this. But this is from what we've heard and what we know as stupid Americans.
I mean, yes, and like I said, this universal healthcare is paid through taxes, so that means our taxes will go up.
Yep.
But
that you know your taxes, what they're going
you know what you're going to. As a tax paying adult, let me put it to you this way. When I see my money at work, like streets getting paved, new pipes being put in, universal health care, believe me, I'll be happier paying my taxes that way because it's one less thing I got to worry about.
Well, it's so funny because your taxes go up, but you're not paying an insane premium every month for the health care, which if you don't even go to the doctor that month, you still got to pay it. So at least my taxes are going to something that's going to cover anybody. And when I need the care, I have the freedom to go and get it without that insane out-of-pocket costs. There's no like crazy surprise bills, no insurance middleman in the same way. It's just you go get the care that you need, and that's it. I know there's so many pros, but there's like cons too. So it's just interesting to think about like how universal healthcare could change like the US healthcare system if we ever brought that on. I know it's been conversations for years and years, and the debates go back and forth.
Bernie Sanders is a big person
huge proponent of universal healthcare. But like Obama was too, and he tried to take us one step closer with Obamacare, which I greatly benefited from Obamacare. I got great insurance for a low monthly rate that covered me when I was in that in between period where I was not working a job where I could get insurance yet, but I needed it. I wasn't covered on my mom's plan anymore.
I mean, it helps more people than it hurts, and it's want to know why Obamacare got taken away is because they want to do their own plan. It's like Democrats want to do theirs. When a Republican gets in there, they want to cancel the Democrats one, put the Republican one in, and it goes back and forth volley instead of working for the people and being like, how about we do something that we all agree on that just helps the people of this country. It's like,
something that actually could just benefit everyone, and universal health care would benefit us as a whole.
Yeah, because it's a simpler plan, it's a simpler system, less billing chaos.
We would be so much healthier too. No one would avoid care because of the cost of it.
And you don't get denied.
You won't.
You're
not waiting for claims and getting sicker and sicker.
Yeah.
So but on that note, I have heard with universal healthcare, like I mentioned, with it being long times in between specialists, there are stories of people who did get significantly worse because they had to wait so long for specialists because they didn't have the private healthcare. So, as mentioned, there are those cons too. Like you don't have as many choices.
You want to know, what that disencourages the country to do? How about you give an incentive for people to go back to medical school, make it more affordable, and then you get more doctors into the system, and you make a healthier government healthcare system overall because you have government-funded doctors who got rebates to get their education.
And T-Money will be on the ballot for Senate in the next upcoming election.
We've talked about it. I am leaning a little bit that way.
And this is one thing I think about because the one thing with the U.S. is like, I know it's hard with specialists since COVID really to get in. I feel like the wait times have gotten significantly long to get in with certain doctors and things like that. But we can pretty much get into a doctor whenever we want. Walk in, get seen pretty quickly. Urgent cares are urgent. You get in, you get seen pretty fast. When I was just in the emergency room with my son.
Oh my God, that story was crazy.
Oh my gosh, yeah. We dealt with that whole thing. I don't even want to see the bill. But we were not there for that long with what they had to do for him. So when I think about those sort of things, like, would you trade faster care for cheaper care, or would what would you prefer? Because I know, like, sadly, because I am American, I'm so all about like instant gratification and getting things right then and there. But like free care just sounds so appealing.
It does sound very appealing. I mean, like I said,
it's not free. You pay in your taxes.
For cheaper care. So I would rather pay a little bit more for better care than cheaper care because, like, I always, the rhyme of like you get what you pay for. It's like sometimes, when you buy that thing off Temu that's like $4 and you get it and you realize that couch you ordered is like 10, 12 inches by 14 inches, and you're like, oh, that's why it was so cheap.
What I expected.
And it's like,
you get what you pay for, right?
Yeah, so it's like I'd rather pay a little bit more out of my taxes. Yes, it takes more out of my wallet. I get that, but I get better care and it's free.
Yeah.
Yeah, I would probably lean that direction because it's, like I said, if you do the incentive with the doctors, you're gonna have more opportunities and choices.
Yes.
For those people who actually need it.
I think choice is so important in the medical system, like, because some providers are just not great and do not always have the best intentions. And I'd rather be able to pick my provider. And that is a thing with private health or with the universal health care is like you do have a lot less options. So I agree with you. I would definitely want to move towards universal health care with the private options as well.
Yeah.
That can give you that like top-notch care.
It's a tough decision, but it takes it takes an agreement from both sides, Republicans, Democrats, even those independents in the middle, whatever you want to,
Louise.
like,
for us all to actually agree on something, come on, something that works for everyone.
Can't we all just get along?
No.
I mean,
I will say, there are some things that we can do to navigate some of this, like some tips. And these are just some things that like I've learned. I bet you have some tips too.
Absolutely.
Because like I've had to navigate the medical system so much between my kids, myself, all of that. And it's like the one thing I always do is ask for an itemized bill.
Oh, you have to, because I want to see it. I want to see
what you charge me. I want to see a breakdown of every charge before I pay anything.
How many of those times did you charge me for?
Yeah. And I'm going to sit down and I'm going to look through the whole thing and I'm going to double check all the charges and make sure there's no double charges on there. There's no services that were charged that I didn't receive, even small little fees for like things that I didn't receive. Nope. We're getting that taken off the bill.
Listen, I understand that, appealing denied claims is annoying and it takes time.
Yeah.
And,
I mean, I had to do it 3 times as mentioned.
And, I understand in our busy schedules, that's not always what you want to be doing because they leave you on hold. And sometimes you can't get somebody on a Saturday, so you got to do it during the middle of the week.
You don't even do it on the phone. You wait. You have to mail in something and you just have to wait for a letter to come in the mail telling you if you were approved or denied.
I get it's annoying, but it's worth it in the long run because, sometimes, you can get things appealed, taken back or, but one of the things that, I thought was great is when sometimes like you said earlier, it's like, what happens with the non-insurance price versus the insurance price or like the cash price? Because sometimes,
sometimes it's cheaper.
Sometimes doctors will do that.
Sometimes before you even give your insurance information to a doctor, say, what would the out-of-pocket cost be without insurance? What is the cash price?
Sometimes.
Yep.
And sometimes it's like for teeth whitening. It's like he can put it through my insurance and they may cover some of it. He goes, but if you do it this way,
be a lot cheaper.
Grease my palm, I'll grease Jersey, bada bing, bada boom.
But always ask for that cash price, especially for like more expensive services that that they can upcharge the insurance company for and make your copay or out of pocket for like significantly increase.
I mean, you're pretty good at negotiating bills.
Well, that was my last tip. You freaking read my mind. Like the last thing that I would totally say, and I've done this, I did this with bills before, like large hospital bills, negotiate your bills. Call the billing center, talk through those charges, especially the things that are outrageous, and say, nope, do your research, look at what other people have been billed, do some Google searching, like find out what the average cost of those services is and negotiate your bill and get it reduced down.
So Driz, basically what you're saying is staying healthy is cheaper than getting sick.
I mean, yeah. I don't know about you, but like, that's not even guaranteed. I can't afford to go to the doctor.
Well, like I said, always remember, don't sneeze on me because I can't afford it.
Ugh.
This is T-Money dropping the mic.
We out.